you all had a good lunch? Yeah, peanut butter and jam, that tastes nice, doesn't it? Different sort. Anyway, it was all good food, and you can always come here on Sabbath. There's always good food. We're going to go into session 3. And session 3 says healing heart diseases.
Okay, so let's start with the questions. I had a couple from the last session. So one was about fatty liver disease. Now, fatty liver disease is an absolute epidemic in our community now. What causes it? Well, there's 3 main drivers: too much cholesterol, too much animal saturated fats, and too much processed sugar. Does that sound like the foods that we're primarily eating or what? But they're the drivers for fatty liver disease. And why is that important? Well, a fatty liver is not benign. It causes inflammation. You get a hepatitis from it, not like a hepatitis from a virus, but a different kind. And you can go on to develop liver cirrhosis as well, down the track as well. So it is something that we do need to address. So if cholesterol, saturated fats from animals, and processed sugars are driving it, then there is no doubt that we can say that that whole food plant-based diet is a thing that we need to adopt, particularly if we've already got the signs of it. But even before that, if you want to prevent it, that whole food plant-based diet is the one that you really want to target there. In terms of a couple of natural things you can do, dandelion root's pretty good for the liver, milk thistle as well, that's another herb, and the bergamot orange. So the bergamot orange has quite a few different effects, but is actually quite protective for the fatty liver as well. So there's a couple of good natural options. Talking about decaf coffee. Someone asked about organic decaf coffee, because I did a big spiel about coffee this morning, didn't I? Sorry about those people feeling guilty. Do I recommend decaf coffee? I sound really sorry, don't I? Do I recommend decaf coffee? No. Why is that? Because it's not just caffeine. There's other methylxanthines in coffee, tea, and also in chocolate. So there's theobromine and theophylline as well. Obviously, they're not quite as potent as caffeine in their effects, but they can still have some effects on your health as well. So I don't recommend decaf. In terms of a drink, things like dandelion root, chicory root, barley, they're all great options for a hot drink. And of course, all your herbal teas. Is non-GMO soy milk good to have? My recommendation is obviously not to get genetically modified foods in general, but when it comes to soy, these soy crops are generally speaking sprayed very heavily, at least 4 times before harvest with Roundup type sprays. So my recommendation is, if you're going to drink soy, use obviously whole soybean based soy milks, use non-GMO versions, and also organic. Where do you get Triphala? Good question. I normally go to Austral Herbs as my primary site for medicinal herbs, but they don't have any in stock at the moment. You might have to go on their wait list, but there are some other websites online that do sell the Triphala powder. With regards to the types of herbs, the companies that sell herbs always go for Australian companies. They're much more highly regulated. You're far more likely to get the product that you actually paid for. So that's just an important thing to note. Now, my website's up there again for everybody, just to remind you. So if you want notes, just go to the website, look up the health editorials. There'll be one on Healthy Hearts there, and you can just download that and get the information off that if you like. So, one of the biggest killers in our modern society, of course, cardiovascular disease. And primarily, the driver is our poor lifestyle choices, and some of the big stress as well in our lives. So they're the things that we're going to sort of have a look at today, particularly those lifestyle choices. So now, the big risk factors, most of these will be no surprise to you: smoking, high cholesterol and other blood fats such as triglycerides, high blood pressure, being overweight or obese, having high blood sugars or diabetes, having an unhealthy diet, physical inactivity, drinking too much alcohol, and of course a whole lot of psychosocial stresses. Now, one of the most amazing things I've ever learnt in medicine is about a special thing called the heart-brain. So around the heart, there is a special nervous system that sits around the heart there. And for many years we've known that emotions have been able to drive things that happen with our heart rate and blood pressure, all these things we see happening. But we always thought this was just due to our nervous system obviously responding in concert with the brain and our thoughts. However, research in the last 30 years has found that the heart has its own little functional mini brain. And I must admit, what drove me to look into this was because when I was working in our coronary care unit, where obviously we see all the patients come in with major heart conditions, some of them have had heart attacks and lots of other issues with their heart. And very commonly, I would see these people become very depressed after their event. And you go, well, that's pretty normal. They've just had a major life event. But I didn't quite see that when I was dealing with cancer patients or when I was dealing with stroke patients and things like that. There was something specific happening there. And I remember one of the cardiac nurses said, oh, that's really common. It's really common to see depression after they've had a big heart attack. And I said, but why? What is it about this? And she said, oh, I'll look into it. There is actually something about the heart has a nervous system. Oh, okay, I'll look into it. So here's what it has. So this particular system, it contains several types of nerve cells or neurons. It has neurotransmitters, supporting cells and proteins similar to those found in the brain up top. It operates and processes information independently of our great brain and the rest of the nervous system. It even has its own type of logic and thought. It can send messages to our head brain, including the higher center regions. And the head brain understands our heart brain so definitively that it can obey those messages from the heart, influence our perception, our mental clarity, our creativity, decision-making, and many other cognitive processes. Now, the greater the coherence between the heart rhythm patterns, the more positive the effects. So how does it communicate? Well, the heart's nervous system, or that little brain, has the most powerful and extensive electromagnetic field in the entire body. So with the magnetic component being 500 times stronger than the head brain. The heart's electromagnetic field is so strong it can be detected a couple of meters away. It is through this means that the heart can communicate with the brain and indeed with the rest of the body. It is so powerful they have even discovered that one person's heart can actually synchronize with another person's head brain. So intuition may actually have some science behind it there. So how amazing is this? So although we've always known there was something special about the heart, all that wonderful literature, whether we're talking Bible literature or we're talking Shakespeare, all of these sorts of things, they've known that the heart's had a special place, and science has caught up to that. So here's a couple of verses that take on a whole new meaning. Create in me a clean heart, O God, and renew a steadfast spirit within me. So if we're embarking on a journey to clean up the health of our heart, we need to adopt this verse and ask God for a clean heart, which will renew a right spirit within you. And what about this one? Above all else, guard your heart, for it is the wellspring of life. So how important is it to value your heart health now that you know all this? So let's have a look at some of those factors. Now, before we address anything else, I am going to talk about smoking. I'm not implying that anyone here is a smoker, but it's something that if you know about, you can tell others about as well. And look, it is one of the leading causes of poor health and death. It causes more than 20,000 deaths each year in Australia alone, and more than 5 million deaths worldwide. Smoking cigarettes is exposing you to about 70 toxic carcinogens, which cause more than 40 different types of cancer. Nicotine itself can destabilize the heart rhythm, so if you have a heart attack and you're a smoker, you are far more likely to die from a fatal heart rhythm. The carbon monoxide exposure from smoking causes damage to the linings of your blood vessels, making it easier for those blockages to form. And benefits to quitting are immense. Your body has an amazing way of recovering from it. So let's see what actually happens. So almost immediately, you'll get an improvement in your heart rate and blood pressure. Within a day, the levels of the poisonous carbon monoxide in your blood will drop to normal, which will prevent further damage to the lining of your arteries. Over the next few months, you improve the circulation through your body and your lung function increases. Over the next several months, your lung will continue to heal and the coughing and shortness of breath will really decrease. At 1 year, your risk of heart disease is half that of someone that is still smoking. At 5 years, your risk of a whole variety of cancers, the mouth, the esophagus, the throat and the bladder, is halved, and your risk of stroke is now that of a non-smoker. At 10 years, your risk of lung cancer is half that of someone who's continuing to smoke. And at 15 years, your risk of coronary artery disease is that of a non-smoker. So the message is it's never too late to stop, because you will get even immediate benefits, but it doesn't take too long to actually get some much greater benefits down the track. Now, most of us would agree that a healthy lifestyle is fantastic at preventing cardiovascular disease and many other health problems. But could we actually reverse cardiovascular disease? And the answer is absolutely. We have good science to back this up. Now, for decades now, this is based on Dr. Ornish. He's an American cardiologist and researcher. Along with his team, they've been studying the effects of lifestyle on changes in the cardiovascular disease. More recently, its effect on other health issues. He's looked into prostate cancer, and now he's looking into dementia, and there's some very, very promising results in the dementia field as well. So he took a group of people who'd proven coronary artery disease from actual angiogram evidence. He then decided to put them on a very comprehensive lifestyle program. At the same time, he took another group that didn't have the same intervention, so they're called the control group. So a very good comparison. And this is what that lifestyle program looked like. So his diet, he really focused on the whole food, plant-based foods there. So lots of whole grains, fruits, vegetables, legumes, and they avoided all processed foods and most animal products. And there was no added oil in their diet. He took out all the free oil. There was no caffeine. Initially very limited alcohol, but I believe later down the track he removed that. But there was no calorie restriction at all. He definitely put in some stress management techniques. 1 hour every day they were to do that. There was very good emotional and social supports that were provided. And they all exercised for half an hour a day. Now, does that seem like a very comprehensive but not too difficult program? It's pretty easy to see how those things could produce those benefits based on the talks we've done so far. But what actually happened? Well, not surprisingly, the group that had no lifestyle intervention had worsening heart disease, increasing blockages in their heart. The group that was treated, even at 1 year, showed significant improvements with actual reversal of their blockages starting to show. Now, they were followed over a few years. The untreated got worse, but the treatment group went from strength to strength. And there was found to be a 300% improvement in the blood flow to the heart of those individuals who stayed on this program. So they were reversing their heart disease. So in summary, Dr. Ornish said we need to eat better, move more, stress less, and stay connected. That was his summary of the program. And we're going to just break that down a little bit more to have a look at some of those details. So the diet. The plant-based diet is not only the one shown to prevent, but also reverse heart disease. So some of the benefits are here. Now, we know that high blood sugar and diabetes is a major risk factor in cardiovascular disease. The diabetes prevention program trial showed that lacto-ovo vegetarians, that's vegetarians that still eat eggs and dairy, reduce their risk of developing diabetes by 60%. If they went completely plant-based, however, there was no animal products, that led to an almost 80% drop in the risk of developing diabetes. In fact, this study actually demonstrated that lifestyle modifications were twice as effective as leading diabetic medication. What about the blood pressure? Well, again, research has shown that the more plant-based your diet is, the greater the drop in your blood pressure. So vegans on average have lower blood pressures than lacto-ovo vegetarians, and meat eaters have the highest rates of elevated blood pressure and use of blood pressure medication. So even in the first 2 weeks of being on a whole food plant-based diet, blood pressure can show some significant improvements. Then there's the cholesterol, the bad blood fats that increase the risk of cardiovascular disease. Does it improve these? And most definitely it does. Now, T. Colin Campbell, he's the author of that China study book that we were speaking about this morning. He compared the diet of those in rural China with those in the United States, some big differences. The Americans had twice the fat, 10 times the meat consumption, and only 1/3 of the fibre when it was compared to the Chinese diet. The cholesterol readings were almost 40% higher in the US compared to China, but that's not where the crux was. When they compared deaths from coronary artery disease, US men were more than 16 times and US women more than 5 times likely to die from this disease. Now, in many non-Western civilizations where the diets are plant-based and low in fat, coronary artery disease is almost non-existent. On average, a lacto-ovo-vegetarian will have a cholesterol level almost 20% lower than a meat eater. And of course, if you go completely plant-based, they will have a cholesterol at least 40% lower. Now, we know that a whole food plant-based diet is usually rich in fibre and has been shown to reduce cholesterol as effectively as statin cholesterol medications. Now, another interesting fact related to cholesterol, even if you remove all of the fat from the meat or animal product that you're eating, the animal proteins alone can also increase your cholesterol. So this is another incentive to get rid of those animal products out of your diet. Now, the benefits of the whole food plant-based diet continue. Research has shown the greater the proportion of plant-based foods in your diet, the more likely you are to have a healthy body weight. Again, this will reduce that risk of heart disease. Now, there are some particular foods that are very, very helpful for the cardiovascular benefits. The allium family, which is including all your onions and garlics, they help to prevent atherosclerosis, or the buildup of that fat in the blood vessels. It helps to reduce the blood fat levels overall. It helps to lower the blood pressure and also helps to thin the blood to keep it moving more freely. And then there's wonderful things such as the nuts. Nuts such as almonds and macadamias and Brazil nuts, these also improve those blood fats and cholesterol as well. So a handful of nuts every day is good to include in your diet. Then we got the globe artichoke. It's shown some very promising results in reducing the bad LDL cholesterol, and also it lowers the triglycerides, another kind of bad fat. But the trick with the artichoke is the most potent part is actually the leaf. It's the leaf of the artichoke you want to get the most benefit. Now, I did mention the bergamot orange earlier in terms of fatty liver disease, but it's one that is great to use in terms of its benefits on cardiovascular health. Now, it activates a special enzyme called the AMP kinase. Now, it's kind of a master metabolic switch, and it breaks down the sugars and the fats. It improves the circulation through the very small blood vessels. It converts small LDL to large LDL, small HDL to large LDL, which is actually improving the blood fat profile for you. It is protective against that fatty liver. And it also helps to block cholesterol absorption in the gut as well. So the bergamot orange. I have a bergamot orange tree growing in my orchard, and I got to eat the first one this morning. It was tough. It's very, very tough. Think of a lemon and then multiply the sourness by about 5, and you'll probably get that. So probably easier to take this one as a supplement than as a fruit. It is tough. And it was ripe too, so I can't imagine if it was unripe. Now, we all know this little rhyme, don't we? Baked beans are good for the heart, and I'll address the rest of that rhyme in a minute. But there's a really good science to back up the benefits of legumes of all kinds. So what are the legumes? Well, here's a list. The black beans, butter beans, cannellini beans, chickpeas, kidney beans, peas, soybeans, red lentils, just name a few. Now, black beans do tend to come out on top in terms of their benefits for the heart, but any of them will be good for you, so you can choose any of your favourites there. Now, they're full of protein, good protein, healthy type, fibre, folate, potassium, zinc, iron, and a whole host of antioxidants. And they're naturally low in fat, and they have low in salt and have no cholesterol. So it's a wonderful food. And for those who are time poor, you can get the same benefits from the canned varieties. So you don't have to go through the process of obviously soaking and pressure cooking, but if you have the time, that is always a good option as well. So what do we know? Well, it's as good as or better than cutting calories for slimming down. It helps to improve the health of your gut, despite what you may think it's doing there. It helps to lower the blood pressure. It helps to regulate the sugar and insulin levels. It decreases the level of bad fats. And it also reduces the risk of not just heart disease, but stroke, diabetes, cancer, and would you know it, depression. Alright, so for the rest of the part of that rhyme there about the wind, here's some scientific tips to help reduce the wind, because I know it is a constant concern, particularly for those who are going from a meat diet to a plant-based diet. This is always going to be a problem, well, for most people it is anyway. But I will say, in terms of why you get the wind, it's because you get digestion of the, you get the fermentation of undigested sugars in the colon, and even though that's giving you wind, it's actually also helping to be a really good sort of probiotic or prebiotic to your colon. So it's actually helping the good bacteria despite the fact that you're getting the wind. So, but anyway, here's some tips. The leading cause of excess wind in our diet is actually dairy. It has been shown to be dairy. So the first tip is to maybe reduce or remove the dairy from your diet. Now, the other one is that the research shows that if you have beans in your diet daily, most individuals will have no symptoms. And in the ones that did by the second or third week, about 70% of those individuals reported a significant decrease in the wind. So the second tip is to have them on a daily basis. The third is you might want to just stick to the lentils, split peas, tofu or canned beans, as they are less wind producing. And the final one is adding garlic can also lessen the gas producing effect. So there's some tips for those who might be transitioning and have issues with wind. Now, magnesium, another mineral that's front and center for cardiovascular health, deeply involved in your blood pressure, blood fats, blood sugar, and some really good healthy sources include all your legumes, leafy greens and your whole grains. So make sure you get plenty of those. Now, omega-3 fatty acids have multiple benefits in the heart health. We know it decreases blood pressure. It lowers the bad fats, in particular triglycerides. It helps to keep the blood thin and prevent blood clots. It also reduces the risk of developing heart rhythm issues. And healthy plant sources are your flax or linseed, walnuts and chia seeds. So on the subject of omega-3, just a little bit of a word about fish oil. Now, lots of people are on fish oil because they think they're going to get some wonderful benefits for their heart health, but when they collated all the data, here is the outcome. It provides absolutely no protective effects for heart attacks, for sudden cardiac deaths, stroke, and it does not prevent death from any sort of heart disease or other causes. So although omega-3 fats are good to include in your diet, more for the benefits to the brain as well, there are certainly good plant sources, so you don't have to resort to fish oil. Always use your flax or linseed or your chia seeds, and walnuts as well. Now, as part of a plan to prevent and restore your health overall, consider the no alcohol and no caffeine advice. Now, there is benefits to this. First of all, caffeine does have some negative effects on the cardiovascular system, made worse obviously the more you have. It can raise the blood pressure, cause palpitations and extra heartbeats. It makes blood vessels constrict in the body, in the heart and in the brain, and it can also make the blood vessels stiffer. It is linked to higher levels of cholesterol. It increases your risk of having a heart attack, particularly if you have diabetes, interestingly enough. So staying off the caffeine will improve your blood pressure, cholesterol and heart attack risk. Now, the cardiovascular system is also very much adversely affected by alcohol. So even at the time of drinking, immediately both the heart rate and the blood pressure will increase. In the long term, this can lead to ongoing high blood pressure and increased heart rate and even weakening of the heart muscle, and I think it's the third leading cause of heart disease now, is alcoholic cardiomyopathy, where you have a weak heart muscle, and irregular rhythms of the heart. Now, alcohol can also raise your levels of blood fats, such as the triglycerides in particular. So by taking alcohol out of your diet, you will also have further cardiovascular benefits by reducing your stroke and heart attack risk. So caffeine and alcohol, I've lumped them together because they do have similar benefits by removing them. Now, stress. It's a huge factor when it comes to lots of chronic disease, and the heart is no exception. So just a reminder of some of those principles that I gave you in the last lecture. Obviously, prayer and meditation is always important, praying to God and depending on Him, taking time out to rest and recover when you need it, always maintaining that positive attitude and developing the attitude of gratitude, and sharing your load with those you can trust so you don't have to bear your burdens alone. Foster that spirit of forgiveness, eat a healthy diet we've just talked about, get some regular activity, which we will talk about, and make sure you establish a regular sleep routine and stay very connected as much as you can with your family and friends. All right, let's talk about exercise. One of the key factors in preventing, treating and reversing heart disease. Now, globally and in particular in the Western cultures, there is an increasing trend towards eating more energy-dense foods and, of course, reducing physical activity. So it's a very, very bad ratio to have. So exercise alone will improve your blood fats. It will reduce your blood pressure, improve your blood sugars, improve the blood flow through the heart muscle. It helps to prevent blood clots and abnormal heart rhythms. Overall, exercise reduces your risk of cardiovascular disease by 30%. Even if you do nothing else, that's the benefit you get. And in one large meta-analysis, where they just basically collated a whole lot of studies and brought all that data together, there was nearly 340,000 subjects in that. It found that exercise is as good as medication in preventing coronary artery disease and pre-diabetes. So how much exercise is enough? It's kind of repetitive, isn't it? Half an hour a day. So 3 to 5 hours per week seems to be the best window. If you exercise moderately, about 150 minutes per week, research tells us you will decrease your risk of heart attack by 55%. Now, some tips to do this and make it easier. Do it with a family member or with a friend or in a group. It's good for the social aspect, of course, and it makes it much more enjoyable and there's more accountability. Choose more than one type of exercise. This is particularly helpful when there's weight loss to consider and also the boredom factor. And set realistic goals. So if you're very unfit, obviously don't start out with the really high impact long sessions. Start with low impact, short sessions, and just gradually improve from there. All right, let's look at some of those herbs that we can use in heart health. Now, hawthornberry, it has a very long tradition in the use of heart as a good heart tonic, so to speak. It has some properties that help in a number of areas. What we do know is that it enhances the blood flow through the coronary blood vessels. It improves the contraction of your heart muscle. It protects the heart muscle from damage. It helps with abnormal heart rhythms. It lowers blood pressure and reduces cholesterol. Now, just take care as it can interact with some medications. So if you're going to take this, always check with your doctor and make sure they monitor you as you're taking it. And the dose is 1 to 3 grams per day. The next one is hibiscus or rosella tea. It's made up of those little calices of the flower there. Great herb for heart health. It's been shown to be as effective as some of the blood pressure medications that we use. As a bonus, it can also help with weight loss, and the dose is 1 to 3 grams each day. Now, ginkgo biloba is another herb that has some circulatory benefits. It does help to improve blood flow in the heart blood vessels, particularly in and potentially in other blood vessels as well. We know it does provide some protective effects in the brain circulation, and in this case we use the tablet-based extracts rather than a whole herb, and you just follow the guidelines on the product that you've purchased. And the olive leaf extract. Well, the olive leaf has been shown to lower blood pressure mildly and also does help a little with the blood fats as well. And the dose there is 1 to 3 grams of the dried leaves each day. So here's a summary of my heart prescription for you. Always include God in your healthcare plan, and like David, ask God to create a clean heart and renew a right spirit within you. Adopt that whole food plant-based diet, which provides the best dietary means to not only prevent but reverse your heart disease. Particularly pay attention to the garlic or onions, legumes, leafy greens, and a small handful of nuts such as walnuts or Brazil nuts or macadamia nuts on a daily basis. Avoid the harmful effects of caffeine, alcohol, and smoking by removing these from your lifestyle. Manage that stress, always important in any chronic disease prevention and management. Get some regular exercise, something to make you huff and puff for half an hour each day. And finally, don't forget some of those helpful herbs. You might like to try some hibiscus and hawthorn berry tea. Thank you very much. Now you can all get up and do some exercise for the next 20 minutes while you wait for Rui.